drill by now that all the attendees were muted upon entry. So if you have any questions that you would like to ask as they go on through the presentation, you'll see that there is a chat box where everybody is introducing themselves right now. So you can enter your question into that, and the attorneys will either address them as they go if they can, or at the end we're going to go through some of the left questions and in the Q&A portion of the presentation. Before we get into our presentation, I really wanted to thank you all for your membership, and for those of you that aren't members that are still joining our webinars, for your support. It's been a very strange COVID era, and we're happy that the SVO has been able to continue its operations and provide you with resources and tools, and we really can only do that because you guys have been supporting us. So thank you very much for that. Wanted to make sure that you guys knew that we have a section on our website, which is the SVO.com, dedicated just to COVID-19 business resources, and all the new information that we get, we will try and post it on there in a digestible form that will help you kind of understand a little bit more about what's happening, because it changes, seems like, every day. So speaking of that, we are happy to have this conversation this morning because we just heard that there are some new businesses that are and activities that are allowed to resume. So this talk is going to be great timing because we're going to touch on a little bit of what you as an employer needs to know as we look like we're moving more towards opening back up the economy and progressing towards kind of our new normal. So with that being said, I'd like to introduce Susan Bishop and Eileen Kennedy from Berliner Cohen, their labor and employment law team. So Susan, Elaine, thank you for being with us, and we'll let you take it from here. Oh, Eileen, sorry. I think I said Elaine.
Thank you so much. We're really happy to be here. We appreciate being given this opportunity to speak with everyone. So, and in this new way, 6 months ago, I don't know that I would have been able to do a webinar like this. And so now I'm learning all these things. So it's been good. So I'm Susan Bishop. I'm going to talk for the first section of the presentation, and then Eileen's going to talk on the second section. We've had a couple questions before the seminar that have been asked, and we're going to try to answer those throughout the presentation. And also, if questions come up while we're speaking or that you had and you hadn't asked previously, if you want to submit those in the chat box, we're going to have someone monitoring those. And hopefully we're going to have enough time to go through a lot of those questions at the end. We're hoping to leave 10 minutes for questions at the end. And if we can't get to the questions, or there are more questions than we can get to, we will try to figure something out for addressing those at a later time. So we'll work on that. But we'll try to answer sort of the most common questions, and hopefully our presentation answers a lot of them as we're going along. So without any delay, let's talk about what I want to talk about today, and that is reopening. Now, Eileen, can you go to the next slide? Maybe. Okay. Well, while we're figuring out how to get to the next slide, because I don't think that I can. Eileen's gonna.
Susan, I'm on the reopening the big picture slide. Is that what you're seeing?
I'm not, but I'm just going to go with it then. I'm going to trust you're doing it. Yeah, I can't see that for some reason. I'm still on the.
This is Monique. Sorry about that. Eileen, you may have to go and share your screen that has a presentation on there.
So you're not seeing it.
And the chat box said that they're still on the first slide as well.
Okay.
So at the bottom it says share screen, and then let's see. And then when you hit present, you may have to go back down to the green button and click the screen that has the presentation.
Can you see anything now?
Just the first screen. Sorry, everyone. Give us just a second.
Can you see the seconds?
Yep, second one. All right. think we're on. Don't worry, I talk fast. We talk fast. Okay, so what we wanted, can you get to the next one, Eileen?
Yes.
Okay. So I still can't see the next one, but
Can
okay.
you see it now?
All right, now we can. Okay, so we just want to go over quickly some of the shelter-in-place orders, some of the social distancing protocols, some of the common questions that we get. I can say that our practices have changed in the last few months. So much of our business now is talking to businesses about how do we implement this? What do we do about this? Let's come up with some ideas. So we want to share those with you. Some of the common questions, some of the common solutions that we've seen. What's so interesting about this is these are all things that none of us dealt with 3 or 4 months ago, right? None of us even knew about these things. Was there a word social distancing 3 or 4 months ago? I don't know, but I hadn't heard it. And so it's all new and we're coming up. I think what we're learning is we have to be flexible and we have to be sort of willing to change and come up with new ideas that work for our businesses. So with that, as a sort of big picture idea, for shelter in place, we all know that there's some sort of federal guidelines. Most important, we have some state guidelines, we have city, we have county, and then we also have business. Eileen, we're still not catching up with the slides. Do you have the next one? Okay. Okay, so what's most important is that all businesses, I think we know by now, we all have to follow all of the orders. But if there's a conflict, we have to follow the one that is most restrictive for our jurisdiction. So for example, if our state is in phase 2, but our county is in phase 1, our business is going to follow phase 1. As we know, this is constantly changing, so much so that it probably everyone knows, or if you don't know, San Jose just issued its new revised shelter-in-place orders that are going to be effective June 5th. So if you haven't seen those, I definitely recommend that you take a look at those and go on to San Jose's website. They have a pretty good website to show what the changes are. I can say, generally speaking, there are fewer restrictions and there's going to be allowed some outdoor dining at restaurants, some in-store shopping, manufacturing, house cleaning, no contact in-home services, no contact services such as shoe repair, watch repair, and other services, and pet grooming and dog grooming are all opening up. That said, all of them still will be opening up with our social distancing protocols. Nothing in the new order changes the social distancing protocols. The only thing that changes is that it expands some of the businesses that can start operating on some basis or on a larger basis than before. So you're re-entering the workforce. You're one of these businesses that can now open up, or you have opened up and you still have questions. I think the first thing a business wants to do when they're going to return to work is first understand there's a new normal. No one's going back to work like they were months ago. That's just not happening. I came to the office today and there's tape all over the floor. There are partitions places. There's hand sanitizer everywhere. There are signs everywhere. This is the new normal. When people are walking around, everyone has masks here. This is our new normal, at least for the distant future or the near future. So the first thing is to be open to that. This is new and we have a new normal. So the first thing is social distancing protocols. Now, all of our counties and cities have their own protocols, but most of them are fairly similar. If you're not in Santa Clara County, you're going to want to look at what your county has. But if you're here in San Jose or in Santa Clara County, you want to look. The social distancing protocols are, keeping 6 feet away from people, wearing masks, washing hands, all of those things that we had to do. covering coughs and sneezes, avoiding social interaction with people who are sick. All of those things still remain in place. So that's the first thing we have to understand, is we have to look at our businesses and figure out how we can implement these social distancing. Some of the things are sad that we're not going to be able to do because of this. At our office, we had, in our office, we had Bagel Thursday. Every Thursday, all of the people would come and we'd all get bagels and share bagels. And it was great. It was a great sort of employee morale kind of thing. We're not doing that anymore. That's not going to happen anymore. We can't have those kinds of functions anymore where people gather in a small place. So we're going to have to make changes, but it's important. We're still going to have morale, things to boost morale, but we're going to have to be creative about what those are. I talked to a lot of other businesses about how they're doing social distancing. A lot of businesses I'm talking to are having alternative work schedules. We're doing that at our office. We're kind of staggering people who are coming in. I think that's going to be a necessity for a lot of businesses. Some businesses are staggering lunch hours. So some people can take lunch at noon, some have to wait till 12:30, just to try to keep people distant from one another. Partitions. A lot of partitions are coming up. Our entire copy center have partitions now. We never had that before. And telecommuting. The other thing is, a lot of us have been working from home. The understanding with these social distancing orders is that if you can still have people working from home and telecommuting, that's still a good idea. That's still recommended. Okay, so the next thing, so in social distancing, one of the things that we're going to have to do is we're going to have to post signs. Now, this sign requirement has been in place for a while, so hopefully everyone has already posted those signs. If not, they can be found various websites, but one of them, the city of San Jose, has the signs that can be posted. Nothing has changed with this new orders. These signs have to continue to be posted, and they haven't changed. Okay, masks. Masks are a big deal. In San Jose, they're required now for all businesses to, that people have to wear masks when they're in a business, when they're going to a business. Now, counties are different on this. Probably we know if you live in San Jose, we were one of the holdouts for a while. We didn't have that requirement. That's different now. We have a requirement. So what does this mean for your employees? Well, we'll talk a little bit more about what we have to provide, but the short answer is that a business has to figure out how to have their employees wearing masks while working. So I've gotten a lot of questions from clients saying, okay, well, who provides the masks? Does an employer have to pay for those masks? What happens if someone refuses? And we'll get to that question, but initially, who has to pay for it? If you go online, you'll see different opinions about it. There are opinions that because a mask is required in the city in general, it's not specific to the business. There are some opinions that are saying, well, then you can require your employee to provide a mask. It's like asking an employee to wear a black t-shirt. It's something they can wear anywhere. It's something that they probably have. It's not a big requirement. So I've seen websites, I've seen law firms giving that advice. I think there's some merit to it, but I think that the more conservative approach and the approach that we're recommending is that the employer provide them. If there is a way for you to provide them, I think that is the safest thing. And that means having them available, reimbursing if you need to. If you say to employees, well, we can't get them, we don't have them, we'll reimburse you up to, $10 or $15 per mask. You can have a set amount of masks, something like that. That's our recommendation right now. A question came up in the chat that I happen to see, and the question is, do they have to wear masks if they're in their own spaces? And the answer is no, that's not the requirement. For example, I'm in my office right now, and I have my door shut, I have my mask off, and that's fine. The rules allow for that if you're alone and you can be separated and you're doing your work. The concern is when you're walking to the restroom, when you're walking to the cafeteria. The other question comes up about while eating and drinking. What do you do if people are eating and drinking? Certainly, yes, people can take their masks off while they're eating and drinking. That's within the orders. But the recommendation is really eat and drink and then put it right back on. And still keep in mind, even with masks, there's still the social distancing required. So if you're eating without a mask, you're still supposed to be 6 feet away. Or if you're talking to a colleague with a mask, you're still supposed to be 6 feet away. So yes, there's recommendations that, yes, you can take off the mask by eating or drinking if you're alone, but to the extent you're interacting with other people, keep the mask on. Oh, where does it allow people to take off? I'll have to look at the rule for where it allows that. I've seen it where people can take their mask off if they're alone shutting the door. Someone's asked that question. I'll have to find it. I'll look into that. Okay, so let me keep going on that. Okay, the other thing we're going to have to, this is a whole new normal. This isn't just getting people back to work, building petitions, having people wear masks, social distance. This is an ongoing change, right? So what we want to do is make sure that we have cleaning standards set. As we've all heard on the news, COVID-19, many people say that, and I think I have no reason to disagree, that the virus can last on surfaces for an extended period of time. So businesses are going to want to have systems in place to make sure things are being cleaned. So the recommendations that I'm always giving is what is assigning one person or a department. I mean, there has to be someone in charge of making sure that this is happening. What type of cleaning is going to depend on what type of business you're in. If obviously the most important things are the high touch areas. Someone brought up the CDC came out saying they don't last on surfaces like they thought. I've seen that too. I've seen that there seems to be a change by the CDC saying that the virus isn't lasting on surfaces like they thought. Right now, I'm being conservative because I think this changes on a regular basis. And I think at least until that's confirmed, I still think that cleaning makes sense. Plus, what I've seen is you have a lot of employees nervous about coming back to work. And if they're nervous, one of the things that you can say to them is, hey, look, these are the things that we're doing. And so if you're cleaning, they're going to be more comfortable. If you say, look, the CDC just said we don't need to clean, it doesn't stay, I think people are going to be more nervous. This is something we can do. It may not last forever, but I think for now that's what we want to do. A question came, what do we do if we can't get these supplies? It's a lot. There's glove supply, there's masks, there's antibacterial, there's a lot of things. What do we do if we can't get it? We have to be creative. One of the things our office is doing, we're going on eBay, we're going on Etsy, we're going to different websites, ordering here or there. We have to be creative. People are making masks. Maybe have to buy masks that are made by someone. There's a lot of things that are out there. And so I'm sorry I got distracted by a comment. But okay, so keeping forward. So what does your business do if Fred reports to work? And let's go on the next slide, Eileen. Okay, right. So Fred reports to work. He has no temperature, but he's sneezing, he's blowing his nose, and has occasional coughing. His manager asks him to go home. Fred says, I'm fine, it's allergies, I want to stay. So the question, and this kind of happens, what can Fred do, or what can you do? Can Fred insist on staying? The answer is no. If an employer wants an employee to go home because they're concerned about symptoms of COVID-19, an employer is within their right to send someone home. That said, it's going to depend. Some of these symptoms that Fred is exhibiting are symptoms of COVID-19, some aren't. So this is going to be a judgment call a little bit. But what's important to know, if the decision is made to be conservative and to send people home, it's important that Fred gets reporting time pay, that he is getting pay for reporting to work under the reporting time guidelines in California. Okay. Okay, and the other thing that comes up is now with this issue of how much does a business want to monitor employees' health. Obviously, essential businesses have higher requirements than non-essential businesses monitoring employee health. But for example, I represent a lot of restaurants, and the restaurants are saying we want to take the temperature of employees that are coming to work. We have questions that we ask employees as they're coming into work. And if they're experiencing any symptoms of COVID-19, we're going to ask them to leave. Or if they have a temperature, then we're going to have them go home. Those are things that 6 months ago, if an employer would have called me and said, hey, we want to take the temperature of everyone coming into our workplace because we don't want people sharing the flu. 6 months ago, I would have said no. That wouldn't have been permissive. That would have been too much of an invasion of privacy. Now it's very clear that these are things that are permitted. And so businesses can do this because of the pandemic that's going on. The CDC is recommending that employers ask certain questions depending on your business model, but asking questions as they come in if they are experiencing any symptoms of COVID-19. I think one of the things that's important for employers is to make employees feel comfortable that they can be honest and they're not going to be retaliated against, they're not going to be penalized if they say, hey, look, I'm not feeling well, here are my symptoms. They don't want to feel ostracized. The employees want to know they're not going to lose a lot of money and income. I think there are concerns about that. This presentation isn't really about all the different benefits that employees might recover if they're suffering from COVID-19, but there are a lot out there, as we all know. So I think it's important that as employers, we're open. We're saying, look, we're just looking out for the safety of people. Okay, so with that, let me keep moving. Temperature checks, we've talked about that. And this is a permissible medical examination now. What do we do if someone tests positive? Well, I think certainly we want to see
Sorry, Susan, which slide do you want to be on? Temperature checks or the next one?
Let's go to the next one.
Okay.
Okay, so an employee tests positive. Oh, so the question that came up, are thermometer checks, they're permissible, but are they required? No, they're not required. And yes, the question is, are self-screenings okay at home? And the answer is yes. Now, my personal opinion is that that is not as effective because I think an employee could easily say they don't have a fever when they do have a fever because they don't want to miss work. Or if I'm going to be cynical, vice versa, they say that they have a fever when they don't have a fever because they don't want to work. So, but yes, that is permitted. There was another question, I didn't see it. We might have to get to the end because it left the box and I forgot what that question was. Oh, but the question is, so California law, does allowing temperatures trump California law? Yes. In this case, yes. There is no question that temperatures can be taken in California, despite previous laws in California because of the pandemic. Okay. One of the things, because I want to get to Eileen and I don't want to take her time away from her, but if you are thinking of doing any kind of medical testing like thermometer, taking temperatures, things like that, privacy is very, very important. These are still medical inquiries that are being made. This is medical information. So it's important that procedures are put in place to ensure as much privacy as possible. First and foremost, you need to let your employees know that this is going to be happening. This is the new normal for the business for the time being. That's important for people to understand coming in. If you are taking temperatures, you want to have temperature taken in a private setting to the extent possible. You don't want a group of 10 people coming in, all being having their temperature taken, someone has a fever, and everybody else knows about it. That's not the kind of situation we want. So if it's possible to have a separate room, if it's possible to have a, sort of a curtained area where people's temperature can be taken, that is ideal. Also, if you are going to have temperatures taken, keep in mind, this is something they're doing for work. This is something that they should be, this is something that should be done. I just looked at the chat. Sorry about that. On the clock. So if someone comes and they're at a restaurant and their shift is at 10 o'clock, but you want them there at 9:45 to have their temperature taken, they're going to start being paid at 9:45. So you want to make sure that this is on the clock work. Okay. If someone tests positive, there's a lot of recommendations on what to do, but certainly you want to make sure that that employee leaves as soon as possible. You want to clean the facility to the extent you can. If they've been there before testing positive, but clean as much as you can. I know there are a lot of recommendations closing your business for a period of time. That's not required though. It depends on your business. If you can't close it, then you won't. Then you can't, but cleaning for sure. Also, the recommendation is that you let your other employees know if they have been in contact with a person who tests positive. So you don't want to let people know who it is specifically, unless the person says, yeah, it's fine, tell everybody that I'm positive. But otherwise, you just want to say someone, and you want to recommend to them that they monitor their symptoms and they be aware of that situation. Okay, now we're going to move to Eileen, who's going to talk about some other situations that come up often.
Okay, just real quick, as I was able to monitor the chat a little bit more closely than Susan while she was speaking. So there's a question about temperature being a medical procedure. It is a medical procedure for purposes of ADA and the state law regarding disabilities, but it's a procedure that you're allowed to do now because of the pandemic. You don't have to be a medical professional. I'll touch a little bit on self-screening at home more in a different perspective than Susan. So with respect to privacy considerations in the workplace, that is coming up, but it's coming up, as Susan had mentioned, where you need to make sure that any information that you have regarding the employee's information, whether it be that they have symptoms of COVID, that they're test positive for COVID, all of that information is private. You need to keep that separate from a personnel file in a medical file. Only those who need to know should be able to see that. Another thing that comes up because of this new era that we're in is that prior in this year, we had a new law, a sweeping new law regarding privacy in California that's largely been overlooked right now, but there is a requirement for covered employers to provide a notice to employees regarding what types of private information they're collecting from employees and what they do with that information. It can be very general. For example, I collect your contact information. I collect your dependent information for purposes of healthcare. I collect contact information for purposes of keeping in touch with you. If now you are collecting information regarding temperature, COVID status, whether or not they've been infected or exposed, you need to revise your policy, a one-liner, what you're going to do, what the purpose of that information is, and what you're going to do with it. It all needs to be kept private. Okay, so I won't spend more time on that. Let's get back to another hypothetical. Fred does not test positive for COVID and returns to work. However, he tells his manager that his wife has tested positive for COVID-19. He also tells his manager that it is fine for him to work because his wife barely has symptoms and he has no symptoms and feels fine. Should you send Fred home? Right now, I'm imagining there's a resounding yes in the audience of people out there. So yes, it is true that you should be sending Fred home. What you should know by now through CDC guidance is that some people are COVID positive and they have no symptoms at all, and they can be contagious. You have to follow the CDC guidelines. The CDC guidelines set forth exactly when a person has exposure and what they should do, and if they are exposed, and how long they need to stay out of the workplace. So I want you to be mindful of that CDC guidance and follow it, because that is the best guidance that we have right now regarding what to do when a person has been exposed. And generally, potentially exposed employees that have symptoms of COVID should self-isolate, and then they have to follow the CDC guidelines on what to do if you've been exposed. And if you've been exposed but you do not have symptoms, you should remain at home or comparable setting and practice social distancing for 14 days. But check the CDC guidelines, because they'll be much more complete than what I'm saying now. If an employee's family member is sick, now this is going to apply to somebody who's in the same household. You have an intimate relationship with somebody. An individual that you've been in close contact with, closer than 6 feet for a prolonged period of time, and you find out that this person has COVID. You need to consult with you have a couple of options. Again, you can go directly to the CDC website to get this. You should talk to a healthcare provider, and if it's determined that if they determine that they will not have a test, then what they should be doing is the employee can leave home and return to work after 3 conditions are met: that they have no fever for at least 72 hours, and respiratory symptoms have improved, and at least 10 days have passed since the first symptoms showed. So again, all of this is laid forth in the CDC. So if you're an HR manager and you're trying to figure out, when do I bring the employee back? What happens if they tell me about this exposure? Go straight to that CDC website, and we'll give you that detailed information you need. There have been a lot of concerns because typically the ADA and the comparable California statute requires you not to ask medical inquiries, but there are many more things that you are now allowed to ask because we are at a pandemic stage. You can ask employees if they're experiencing symptoms of COVID. Symptoms of COVID are coughing, having shortness of breath, chills, shaking with chills, aches, headache, sore throat, loss of taste and smell. Again, this is something that the CDC updates as they get more scientific information, so go to that website to get more information. You can ask if a person has traveled somewhere where there's a hot spot. You can ask for a medical certification, but you need to be flexible if you're an HR manager. Many healthcare providers may be overwhelmed, not maybe now in the Bay Area, but it's possible that that could happen. Be flexible, allow more time for that certification, or perhaps let it go altogether. Now, you also have to remember that we're in a COVID situation, it's in a pandemic situation, so it's different for us, but the same rules apply with respect to ADA and FEHA. FEHA is the California statute that prohibits discrimination based on disability. You still have to provide a reasonable accommodation. For example, suppose you have an employee that cannot wear a mask because their health provider said it will impact how you breathe, you cannot wear it. Your employer refuses to wear that mask at work. What do? Go through the same analysis you would under ADA and FEHA. Do they have a doctor's note? Do they explain what those limitations are? Can you provide a reasonable accommodation based on those limitations? That might mean that they can't come into work, but maybe they can telework. Maybe they're given a leave of absence. Maybe they can come into work but must be isolated. So I want you thinking about that if you're the HR person in charge. Okay, okay, another hypothetical. Suppose Fred remains at home from work due to his exposure from his wife's COVID-19 infection. He calls his manager and he says that his wife has been symptom-free for 2 weeks. However, he does not feel comfortable returning to work. He says there are rumors that 3 of his coworkers have been infected with COVID-19. Can you insist that Fred return to work? Okay, generally speaking, fear alone is not sufficient for an employee to take a break from working. However, what you want to do first is make sure that Fred has satisfied the CDC guidelines and he is able to return. So basically, after his exposure, he has to be COVID-free for 14 days before he can return, not his wife. Okay, so that's the first thing. Secondly, you want to make sure that you're following up with this scenario. Somebody has claimed that there are 3 coworkers who have COVID. You need to do your investigation. You need to make sure that there isn't anybody, that those are really just rumors, that they're not real. Suppose they are real. Suppose there are some other employees exposed to COVID or who have confirmed COVID cases in the workplace. Remember, privacy still applies. You cannot state who that individual is who has COVID. The CDC is recommending that you now inform other employees who have had prolonged contact or contact with those people who have exposure or confirmed cases that there has been a COVID incident in the workplace. And you advise the employees to follow the CDC steps. So that might mean that the employee calls their healthcare provider or goes to go get a test to see if they too have that disease now. But never reveal who it is that that has the actual disease. Okay, suppose an employee refuses to come back to work. This is moving forward with that investigation. You have to make sure that your workplace is safe. Okay, and Susan has gone through a lot of those social distancing protocols that you should be following. And I'll get into OSHA in a little bit, but OSHA generally is wanting you as an HR and a business manager to think about your business in these ways. Is your business, is your industry a low risk industry or a business, medium risk, high risk, very high risk? Your very high risks are your healthcare providers that are treating COVID patients. Your higher risk type of businesses are those businesses that are first responders, that have lots and lots of interaction with potentially COVID infected individuals. You have police officers. You have medium risk retail businesses where you have public accommodations and lots of people coming into that store to purchase things. You have low risk, for example, like Susan and I are in an office law firm setting where we control by appointment who comes in. It's not necessarily a public accommodation. Not everybody comes into the office. The office is shut down. We have protocols. So we would be considered more of a low risk business right now. You have to assess, what do you need to do? What's the level of social distancing and protocols that you need to implement based on your risk? And likewise, when an employee is saying, I don't want to come into work, if you're a high risk or a high risk or a very high risk business, you're more likely to get those OSHA inspections. So what you want to do is make sure that everything is in good standing, that you have all of the PPE that you're required to have, and everything is and that the employees are really safe. An employee can still refuse to come in, and this is probably more likely going to be for those high risk and very high risk businesses if these standards are met in this slide. That they have a reasonable belief of a real danger of being infected with COVID, and they do not have those safety measures. So if you're in a medium risk or even a low risk, what's really important for you to do is to make sure that you are having a dialogue with that employee who's afraid to come in, and that you're documenting everything, that you're checking off all of those boxes, that you have done all of those things for your risk group to keep those employees safe. Okay, so there are a lot of other considerations. I'm going to keep going through the slides. I'm seeing some chats, but it's about almost 1:45, so I'm going to try and get to those chats afterwards. I have a couple more slides and they're a little bit packed. There are new wage and hour, there are the same wage and hour laws that we've always had, but a new application now. Remember that all employees, regardless of whether or not your business is struggling, they have to be paid minimum wage if they are non-exempt. If they are, they're required to also have overtime pay. And if you have non-exempts working from home, you need to have those same time recordings obligations, including when they start working, when they stop working, when they take a meal period, and when they do not. If you have an exempt category, a white collar exempt, for example, and there are certain duties tests that you have to meet for those, you have to make sure that even though they may not be doing their full job now, that they're still meeting that duties test. Their duties may have changed. They may be doing more non-exempt duties now than ever, and that might impact the exemption classification, in which case you might consider changing the exemption altogether, making that position for the time being non-exempt, and redocumenting what those duties are, but also making that individual now track their time and paying that person overtime. Business reimbursable business expenses, you have to consider that if you are having workers, that there are business expenses that they may be incurring because they're working from home, like their internet access, electricity, that type of thing. Our general approach to this is that lawyers are believing that this will be something that may be triggering more employment plaintiffs lawsuits, potentially on a class basis. So what you want to do is you want to make sure that you're giving a reasonable amount of money for those types of business expenses, but allowing the employee to come back and say, no, for some reason, my expenses are a little bit more than what you would normally assess for this. So bear that in mind. For reduction in wages, if you need to reduce wages or compensation in order to get more of your employees back at work, I want you to consider these 5 things. Number 1, with that employee, do you already have a contractual obligation where you are obligated to pay a certain amount of money? This doesn't come up very often, but with C-level employees, higher level employees, that may be the case. You have to honor that contractual obligation. Did you receive a PPP loan? If you did, remember, if you want to maintain the forgiveness, you can't reduce wages by more than 25%, excluding those who make over $100,000 a year. And you have to make sure that you're using the correct comparable periods. So the period would be when you have your 8-week period for the loan, and the comparable period based on the statute and the regulations. Please double check the PPP loan facts. They are changing daily. Even the House has passed new modifications to this loan forgiveness requirements. The Senate hasn't yet accepted it as of this discussion, but you need to keep checking it every so often so that you're on top of it, especially if you have the PPP loan. Remember a white collar exemption that I just mentioned before, there's a minimum threshold salary. You can't go below that salary if you need to reduce wages. And remember, the salary basis test, you definitely want to not make it appear as though their salary is based on how much time they work. So when you're reducing that salary, you want to reduce job duties, not so much time that they need to report. Okay. Satisfying minimum wage requirements, I went over that. Make sure that always happens. If you have people completely out of work and they have been applying and getting unemployment insurance, but now you're reopening and you think that you can bring some of them back, but not full time, remember, partial unemployment is still an option for you. They can change from full unemployment benefits to partial and still work a couple of days a week as long as they're meeting the requirements for unemployment. Okay, on to leave. Remember that there is paid leave for up to 80 hours for COVID-related reason. There are four qualifications for that. After those 80 hours are exhausted, what kicks in at that point is potentially family medical leave. Now, family medical leave paid is only available for where students need to be home and there's no caregiver for them or primary caregiver due to a COVID-related reason. Otherwise, we analyze it based on our existing unpaid family medical leave. Is it a serious health condition? COVID would be. How much time do they get off? Up to 12 weeks. Okay, so you look at it from that perspective, the unpaid leave basis. You also have potentially California and other local paid leave requirements. So there's the California mandatory sick leave that's available at that point for that employee. They can also potentially use paid time off, vacation benefits, any other paid leave benefits that the company has available. And if after that, there's nothing left and they've exhausted everything, it's possible for them to go on to unemployment. I want to highlight that there are several cities now that have expanded the benefits for employees for paid sick leave. Under the federal law, it excluded, if you recall, companies that have 500 or more employees. Under San Jose local law, even San Francisco law, they're included now. Also, there is an exception for those who have fewer than 50 employees at the federal level, as long as you can prove certain requirements that it was impacting your business. Under San Jose, that has been eliminated. So you need to make sure, depending on where your business is, that you're checking your local county and city guidelines or whether there are additional paid sick leave requirements that you need to follow. LA County, LA City, Oakland or three others, and eventually Berliner Cohen will have a chart published on their website. It just hasn't been updated quite yet. And we will have a list of those additional cities. Last but not least, and then we'll open it to questions. Governor Newsom has created a presumption that if an employee is exposed, is a confirmed COVID case after 14 days after being exposed at work, there's a presumption that that person has a work-related injury because the COVID occurred at work. This is a rebuttable presumption. It obviously is not going to apply to a teleworker who has not come into the office. What we would recommend you do is make sure that you're following all of those protocols that Susan went over, that you've assessed things based on the OSHA guidelines, and that you're following all of those CDC guidelines, OSHA guidelines on what you should be doing to keep workers safe. That will help with a rebuttable presumption in determining whether or not this is actually work-related. It will likely affect the rates of employers, but the silver lining in this is that if you are sued by an employee on a negligence basis, you could always defend by saying this is actually something that goes within the workers' comp realm. There are other requirements. I have those on the slide for you, but I wanted to change things now and kick it over to Susan to see if we can get some questions answered that have been in the chat box while I was talking.
Okay, so a couple of questions. One question: what kind of equipment are you required to provide to employees who are teleworking at home? And I think it's the equipment they need to do their job. That might be a computer, a laptop. It might be a printer, paper, ink, internet access. It doesn't mean you have to pay for all internet access, but a percentage of internet access. Like Eileen mentioned earlier, it makes sense to sort of give a lump sum per month, a stipend for all these additional expenses, and then and have a policy that says to an employee, if this doesn't cover it, then come back to us and we'll talk about it and see if we can come up with something else. That's kind of how we leave it. There was a question in the chat box: are masks required for low-risk businesses? And the answer is yes. I'm just reading the San Jose shelter-in-place guidelines, and it's every business. There's this mask requirement.
It's different. Sorry, go ahead.
Oh, and I was going to say, and it is different in different counties and different cities, it may be different. For San Jose, yes, that is required right now. Were you going to say something different on that?
No, that's exactly what I was going to add. And the other piece of it is if you think about the OSHA requirements, so if you're a higher risk, what a mask really is like a PPE, like an N95 mask, which is different than just a cloth covering. So
yeah, that's right.
Yeah.
The lower risks, you don't need those special medical the N95 mask. A cloth mask is sufficient. And in fact, they're saying that we shouldn't be getting the N95s if we're not in those high risk groups. The other thing, I know someone asked me at the beginning, or a question came in about removing masks while you're at the workplace. And so the city's guidelines say that people speaking or presenting can remove their face coverings if they are alone in a room speaking to others via telephone or video conference, or if needed for disability accommodations to allow others to understand the presentation. And it says, otherwise, face covering should stay on, even though it may be inconvenient. So even if they're, so I guess the concern is that if someone's alone in their office, people are coming in, and so the safest method is to wear it unless you're on the phone or doing a presentation like we're doing now. So I think some of the other guidelines are a little bit more relaxed than that, but that's what San Jose is saying right now. The other one, one of the questions that came up a couple of times that I've seen is, what do you do if an employee says, they're offered a job back and they say, well, I make more money working at home, and collecting unemployment, so I don't want to come back to work. I've had that question come up many, many, many times with some of my businesses that I represent. And the short answer is, obviously you can't make someone return if they don't want to. But what I recommend is that you get in writing that you're offering the job and that they're refusing it. That helps you for if you have a PPP loan forgiveness that you need, number one. And number two, it helps you if you decide that you want to let unemployment know that your employee is refusing to return to work. Because technically, if work is available to them, they're supposed to return and should not be eligible for unemployment if they don't return upon a request. Eileen, did you have other questions that you want?
There are a couple of chat questions that came up that I wanted to quickly address, and that is, it's really difficult to assess all of this if you're reading the news. It's just constant. And what I want to do is always direct you back to that CDC website. The CDC website is really supposed to be taking all of the data that they're learning about people who have infections from COVID and assessing what is really the best practice. So, for example, if somebody is exposed to somebody for a long, long period of time, that doesn't mean that if you keep them further apart, that's the guideline that you have to follow. Follow the guidelines of the CDC. That's what you need to do. Don't worry about what's in the news. Just go back to that website if you have questions. Are there required postings for COVID? Sure. Go to your local public health county website. They will have a whole bunch of great posters that you can pull up. There are no differences here between volunteers and employees. If you have volunteers in your office, you're going to be doing the same exact thing. There are probably some differences as to whether or not they can sue under certain laws, but you want to make sure that you're treating them exactly the same way in terms of the safety protocols that you have to follow. There was a question about whether or not we're going to send out the slides. We intend to do that. I'm going to try and get that to Monique right after this webinar, and I believe that she's going to be sending them out. There are potential risks if you have workers' comp issues with employees working at home. So what you again want to do is hear what that complaint is about, figure out how you can fix that unsafe issue. Don't forget to give the DWC form to somebody who has a work-related issue that comes up at home, injury that comes up at home, and treat it just like you would if it were at work. I think we're a little bit out. I think we're kind of out of time right now. Is there anything else that you wanted to address, Susan?
No, I think that there's a few other questions, and we'll figure out a way to get those questions answered. We're going to send out the slides, but there's a couple other questions And there's a question about the template for risk assessment. So we'll see what we can do to get that information to you to answer these questions. But we really appreciate your time and thank you so much.
Yeah, thanks very much. Thanks for your patience with the slides.
Hey, thank you guys. Yeah, so if there's additional questions that we're not able to get to, you can, I will say email to Monique, and then she can kind of capture them and get the answers and send them out and make sure that we get that back to you. And if there's additional questions as they pop up, we'll look at trying to compile all of that and put that either on our website or in an email so that you guys can have the easy access. I know I was taking a bunch of notes and my brain is exploding with all of the potential, oh, well, what if this happens and what if this happens? So I'm sure there's endless opportunities for questions. So thank you guys very much for your knowledge and for taking the time to go through all of this. As I said, there's endless options, so I'm sure it's hard to kind of organize all of your thoughts. So I just wanted to thank all of our SVO members and everybody that was a part of this and our community for tuning in. As I said, just keep watching our website and sign up for our newsletter so that you can get information about additional webinars that we're doing, the latest COVID-19 updates, and our events that we're producing. I was just looking at this chat real quick. Yes, we can try and summarize the Q&As when we send them out so that everybody can have that access to that resource. So, all right, everybody, that concludes for us today. Please take care and stay healthy. Don't get too hot today. And we can't wait to see you again at the next webinar. Thank you. Bye.
Thank you.